afternoon.
Good afternoon, sir.
How are you been these days?
Good, sir. It's the latter part of my training, so a bit busy. I have to sort out the things to hand over my patients to the other registrar who's commencing tomorrow, sir. A bit busy, but I'm enjoying.
Do you think you have any specific issues that you need to discuss with me?
Not much, sir, but I feel now if I get more opportunities to spend time with the patients in the ward setup, it would be great because most of the times I'm involving with on calls as well as the clinics. So if I get more time with the patients in inpatient setting, I would prefer, sir.
Okay, so you definitely have an issue of inadequate time to spend with patients. Now, for that, there could be many factors. What are the factors?
Yes, sir. Sometimes I have to leave it early in the afternoon. I mean, after I finish the rounds and all, because of my family commitments and all. The other thing is there are many patients being admitted during last few weeks because some other hospital ward was closed, so therefore I had to attend for that in the clinics as well. So I think those are the main reasons for that, sir.
So there are system factors and personal factors.
Yes.
So how can you make sure that you can do something in between?
Yeah, I'm now. So I have to prioritize what I have to do, and especially when it comes to training, I have to give the priority for the training as well. But at the same time, when it comes to the family commitments, my wife is also a trainee, so therefore, we have to find some time. So I think adjusting the time between us would be is needed when it comes to my personal matters. But regarding the system problems, I think I can have a discussion with the other parties, other doctors, other trainees, and even the other consultants, the non-doctor staff as well.
Good that you brought out this concept of time, to this discussion. Actually, I want to give you a little feedback which I have found from the others. That some people have told me that you are not punctual, and sometimes you're not there in the ward. And even today, now I gave you an appointment at 11:30, so now you're 1 hour late. So why do you think these things are happening?
So I'm not late all the time, sir. Maybe sometimes I may be late for the ward rounds and for the clinics. Has anyone complained that I'm late all the times?
Well, it's not all the time, but people say sometimes you are late.
Yes, as I told you, maybe because as I told you, so my family commitment that I sometimes get late to come from my home if I stay at home, if I am not on call. But so in on call days, I'll be coming early to the ward, sir. No, not every time.
How can you improve this?
I think if I can make a timetable and make things into the timetable and prioritize things what I have to do, so I have to do on calls, I have to do clinics, I have to attend to the ward work, so I have to table what I have to do, and I have to manage my time accordingly, and I think it will be a way to overcome of these issues.
Okay, so in this discussion, we managed to identify that you have a problem on time and prioritizing, punctuality, and I think if you improve all these things, you'll have more time with patients. I think it's good that you've been seeing all our patients, but it's just that at times, if you are not on time, the system also will not be able to function. Do you have any other concerns that you do want to discuss with me?
Not that much, sir. No.
Okay, thank you, Kosala. Wish you all the best.
Thank you, sir.
In giving feedback, we first have to identify the problem, a specific problem, and let the trainee come out with his reasons and talk through, even in a busy clinic setting like today in the clinic, and come up with solutions together rather than giving solutions by yourself or reprimanding, and also letting the trainee understand his weakness, appreciating the ground realities of busy clinics and family commitments. After all, considering the Maslow pyramid of hierarchy, the ground level is physiological needs, and then the belonging needs like family, shelter, and do not in your feedback touch on esteem needs, because he is the registrar, so he cannot be scolded in front of others, because that will actually impinge upon the esteem needs, that his self-esteem should be respected. So you can always find a place in the clinic when others are not there, or in your room, or while you are walking around the corridor with your trainee, and that's only two of you. Perhaps you would be able to give a feedback, and feedback has to be given best immediately before it goes off its memory, but definitely not in a situation when you are also emotionally aroused and you feel angry about the situation, because most of the time it will be a feedback of your anger and you might tell the wrong thing. So that is how you would avoid giving feedbacks, but of course you can jot down what you want to tell and discuss in a setting, in a neutral setting, and give this feedback in this way.